Let's talk about adenomyosis. Adenomyosis is when the glands and stroma of the endometrium, which is the lining of the uterus, grow into the muscle of the uterus where it is not supposed to be. This causes the muscle of the uterus to hypertrophy or grow, and it also causes the uterus to not be able to contract in an effective way. This leads to painful periods because the uterus is not contracting effectively, and that causes pain. And it also causes to heavy menstrual bleeding because the way that the uterus prevents you from continuing bleeding is by contracting down on the blood vessels and slowing the menstrual blood flow. Adenomyosis also is associated with higher inflammatory markers in the muscle and lining of the uterus, and that can lead to problems with fertility. We don't really know what causes adenomyosis. There are different theories as to why it occurs, but we do know it's more common in those that have had procedures on their uterus and those that have had prior pregnancies and multiple births and deliveries. So there may be some association between the disruption of the layers between the lining of the uterus and the muscles of the uterus, leading to a higher likelihood of adenomyosis. It typically can be diagnosed either with a pelvic ultrasound or a pelvic MRI, but it is often overlooked even with these modalities, if not specifically looking for it. And when it comes to treatment, it really depends on your goals.